Sometimes after an injury or surgery or even a chronic issue with such as knee arthritis, we have a tough time regaining knee extension mobility, which is so important for normalizing walking and running. If we don't have sufficient knee extension, we just place increased strain throughout the knee that could even go all the way down to the ankle and all the way up to the hip and back. So knee extension mobility is really, really important we regain. Now this exercise is commonly known as a calf stretch, but this is not for calf stretching. You may feel a stretch in the calf, but I actually really like this mode of exercise for restoring knee extension. And so I'm going to target my right leg. You need a chair or a table or a countertop, anything that's not going to move, just something to hold on to so you don't have to worry so much about balance. And what you're going to do is my target leg is going to be up on my toe. Stance leg, this leg can remain relaxed, foot flat. My goal though is to drive my heel down into the floor and notice how straight my knee gets when I do this. And I will feel a stretch in my calf as well, but I'm really prioritizing trying to contract this quadriceps muscle to straighten my knee. And I'm gonna hold that for about 5 seconds and then relax and then drive and try to straighten as much as I can. Now, a mistake that some people do, especially if it's early in the phase, is they don't contract their quad. They try to get it from their hip, so they do that. They try to push their butt back. Try to keep the hip relaxed. Drive it primarily from your quadriceps. And if you notice that your heel can't touch the ground, so you notice I'm flat now, if you can't get there, bring the foot up just slightly, reduce the range of motion, and then try again. You do want to try to get that heel down and straighten that knee as much as you can, contracting that quadriceps muscle, holding for 5 seconds or so, and then relax, and then you're repeating. Really good exercise to start mobilizing knee extension mobility. So it's really two birds with one stone with this. You get the quad muscle working, which is often shut down or inhibited after an injury or a chronic pain condition, and then also getting that joint, knee joint, to extend to help normalize how we walk, run, jog,